the things that control that receptor for LDL are three parts. There's a protein around LDL called ApoB, there's a protein on the liver cell called the LDL receptor, and there's another new protein we found which is a regulator of that reaction. So abnormalities in any of these three may change the way the liver handles LDL. So in this paper from 40 years ago, they looked at those patients with an abnormality in the LDL receptor, and what they found was that normally the LDL disappears over a week or two. It stays in the blood for a while, but it takes a week or two to disappear. But if you've got an abnormal receptor, it hangs around twice as much, or twice as long, whichever way you want to. So now LDL that hangs around. And that's what happens in diabetes as well. Normally the LDL goes straight back to the liver and disappears in a week or two. It's done its job in a week or two. But in diabetes, it hangs around. So if we have fructose, just refer to the other talks, you end up with fat in the liver, triglycerides, and they're exported as that big particle, VLDL. The VLDL can interact with HDL through this cholesterol ester transport protein, and in this process of giving up triglyceride and taking up cholesterol, what happens is you wear out your HDL. So any patient with a high triglyceride and a high VLDL being made by the liver is going to wear out their HDL. So high triglycerides always result in lower HDL. That's one problem. The other problem is that high triglycerides interact with that LDL. So that LDL that might be hanging around because you're diabetic and you've got high triglycerides has got a real big chance of reacting between these molecules. And what happens here is triglycerides go in, cholesterol ester goes out, and in this process what happens is the LDL doesn't disappear, it just becomes small and hard. So this relationship between high triglycerides or VLDL and the long dwell time of LDL in the blood is what leads to it being small and dense. And how important is it? Well, the small dense LDL, well, first of all, look at the normal LDL. This is normal big buoyant LDL. If you have increasing levels of big buoyant LDL, your risk of heart disease doesn't change. It may even improve. Whereas if you've got increasing levels of small dense LDL, your risk of heart disease is increasing threefold, 3 to 4-fold. So it's not LDL that causes heart disease, it's small dense LDL, purely small dense LDL.